Hey there, it's Dr. Matt Koval from KidsPeace. As many of you know, I'm the Chief Medical Officer here, and I wanted to take a little bit of time to talk with you about the flu virus and also the flu vaccine. As you know, here at KidsPeace, we highly recommend that everyone on the KidsPeace staff get the flu vaccine. And there's a lot of different feelings about that and a lot of myths that have gone around about the flu vaccine. And I thought I would take this opportunity to educate our staff, but also do a little bit of myth busting. So let's start out with the flu vaccine. Why does KidsPeace recommend it? Well, first of all, the Center for Disease Control recommends that all people who work in the healthcare industry get the flu vaccine because they're at higher risk to contract the flu. Why is that? Well, we work with clients that are sick, obviously that come out from the community, in residential and in the hospital. They're kids who are kept in close quarters, which can also cause the virus to incubate or spread, and therefore all healthcare providers are highly recommended to get the flu vaccine. Even if you work over in the admin building and you're a person who doesn't have direct patient care, you're always interacting with staff who do. I mean, they're in the OD&T training room, they're in meetings with you and so forth, so you're still at higher risk to contract the flu. So the reason why we recommend that you get the flu vaccine is to keep you healthy, keep your family members healthy, but also to make sure that we don't have a great deal of employees that are out on sick leave when they may not have needed to be out on sick leave. One thing I want you to be aware of is, even if you're the kind of person who's felt like, I've never gotten the flu, I don't get sick, or if I do get the flu, it's not that bad. A lot of people think that, but understand that if you have infants or toddlers in your family, or you have elderly folks in your family, like a parent or grandparent, aunt, uncle, pregnant women that are in family that you're going to have contact with, they are a risk group when they get the flu that they can actually have severe morbidity and even mortality associated with flu. Just today I received a notification that a young child was the first child in the state of Florida to die from the flu this year, and that was today. So again, this is something that's very serious, and people do actually die from the flu. I want to take a little bit of time also to do some myth busting related to the flu vaccine. There's this idea that getting the flu vaccine can make you sick. And to coin a phrase you've heard a lot over the last couple of years, that is absolutely fake news. The flu vaccine cannot make a person sick. It's dead vaccine. It would be like thinking a person who was dead could somehow murder you. It just won't happen. People do get some side effects occasionally from the flu vaccine. Sometimes a little bit of local pain where the vaccination was given. Sometimes people can feel a little bit shaky or little body aches afterwards. But one absolutely cannot contract the flu from the flu vaccine. There were some other versions of the flu vaccine, one that's an intranasal version where they did use what's called a live attenuated virus, which means it's a weakened form of the virus. And technically a person could get ill from that, but the vaccine that we use here at KidsPeace, the shot, that is dead virus that cannot make a person sick. Now, you've probably heard people say, well, I did get the virus or the vaccination and I got sick, I got the flu. Well, first of all, the vaccine takes about 2 weeks before it kind of covers you for the efficacy of preventing the flu. So it certainly can be a coincidence that a person gets the flu shot and then actually gets the flu. So what I would say to that person is, you probably should have gotten the flu shot a couple of weeks earlier and you may not have gotten sick. The other thing I wanted to explain is how the flu vaccine is actually created. The flu virus changes every year, every season. It's a virus that mutates very rapidly. And when they create the vaccination, it's actually different every year. The scientists that work at the CDC try to predict what is the new virus going to actually look like, and they make the vaccination specifically to what they predict the virus is going to do. Sometimes they predict very well and the vaccination is very effective. Other times, just because of chance or luck, they didn't predict as well and the virus may not be quite as effective. The vaccination, may not be quite as effective. Understand though, even if they missed the mark, even if they didn't predict very well, it has been proven that the vaccination, even if it's not as effective, if you get the flu, your case of the flu will be less severe. You'll be back to work sooner, you put your family members less at risk, etc. So having said all that, I just wanted to make it clear to you all that it's very important that you get the flu vaccine. To be honest, in the various hospitals that I've worked at, the rate of flu vaccine here at KidsPeace is embarrassingly low. So this is something that we should really remedy. One of the places I worked at in the past, folks actually had to wear a mask for the entire flu season if they did not take the flu shot. So unless you want to be like this for the next few months, which is something KidsPeace might have to adopt if we can't get that number up, I would suggest you get your flu vaccine and you get it as soon as you can. Thanks for your time.